everyone. Dry eye or keratoconjunctivitis sicca is a very common eye disease. It affects almost millions of people every year. And the underlying cause for this disease is either your eyes do not produce the normal amount of tear which is required to keep the eyes wet, or the tears which are being produced by the eyes, they evaporate too quickly so that the tear film is unstable. With increasing age, the risk of developing dry eye increases, and it is most commonly seen in the postmenopausal females because of the hormonal changes which are associated with it. So in this video, I, Dr. Pallavi Mishra, will be talking about dry eye. What are the types of dry eye? What are the symptoms of dry eye and the causative agent, and what are the treatment options available? So let's start. So what are the types of dry eye? When it comes to dry eye, most of the people think that it is because of the insufficient quantity of tears which are being produced in your eyes, but this is not always the case. In aqueous deficient type of dry eye, there is insufficient production of tear film. So what happens is there is a lacrimal gland which is situated on this part of your eye. It is above and lateral to the globe. So in some cases, or especially in the autoimmune cases, there is inflammation of this lacrimal gland. Now because of this inflammation, the lacrimal gland, being the main producer of the tear film or the aqueous layer of the tear film, is not able to produce the sufficient amount of the aqueous layer. So it causes the aqueous deficient type of the tear film. The second thing is the evaporative type of dry eye. So when the tears evaporate too quickly, which generally happens because of the insufficient amount of the lipid layer. So what happens is, in the tear film that we have, the first is, or the bottommost layer is the mucin layer, then we have the aqueous layer, and then we have the lipid layer. So if the lipid layer is not produced in the sufficient amount, so the water content of the tear film, it evaporates too quickly, leading to the evaporative type of the dry eye. Now if both these conditions are found simultaneously, we have the third type of dry eye, which is the mixed type of dry eye. Now coming on to the symptoms or the diagnosis of dry eye. Now dry eye is a disease which is diagnosed by the patient himself or herself. So there are few telltale signs which leads to the diagnosis of dry eye. First is the dryness in your eyes. Second is there is eye discomfort, there is burning, stinging, itching in your eyes. Then we have the foreign body sensation on the eye surface, redness, sensitivity to light. There is some stingy or mucus around the eyes which we call as the चिपचिपा पदार्थ निकलता है आँख से. The eyes are watery, there is blurring of vision, there is increased eye fatigue. If you are a regular user of contact lenses, you have difficulty in wearing contact lenses. There is also associated dryness of the nose and the mouth. So these are all the symptoms which leads to the diagnosis of the dry eye. Now coming on to the most important and the treatment part of the dry eye. So the first and foremost thing is to make the exact diagnosis, that what is the underlying etiology or what is the underlying cause which is causing this disease. So if you have an evaporative type of a dry eye or the aqueous deficient type of a dry eye, the first thing that the doctor will prescribe you is the over-the-counter available lubricant eye drops. It can be carboxymethyl cellulose like the Refresh Tears or the Refresh Liquid Gel, or some more thicker or more viscous lubricating eye drops like the sodium hyaluronate or the polyethylene glycol like Mostane or Optiv. So this is the first treatment modality. Second is to increase the production of your own tear film by the decreasing the inflammation. For this, the available drugs are the Restasis. Restasis is an anti-inflammatory drug which contains cyclosporin, and it decreases the inflammation and helps in the production of the tear film. Then important thing is lifestyle modification. If you are a regular user of mobile, laptop or contact lenses, you have to decrease the screen time, and the doctor might ask you to discontinue your contact lenses for some duration of time till the condition of your dry eye resolves. So it would be better if you discontinue contact lenses, because the contact lenses also aggravates the dry eye condition of your eyes. Also, the screen time should be decreased, or you should follow the 20-20-20 rule, which says that if you are working on a screen or a laptop for 20 minutes, take a 20-second break and look at 20 meters away or far distance, so that you blink your eyes and you replenish the natural tear film. Third is, if you are constantly staying in a air conditioned room, you should decrease the time, because air condition also causes dryness. Take adequate sleep, and few dietary modifications are also advised, like increase the amount of vitamin E, the omega-3 fatty acids, increase the amount of water in your diet, keep your body hydrated, because all these things, they changes the intrinsic or the internal factors of your body and helps in fighting with this dry eye condition. So in my next video, I'll explain the other surgical modalities like LipiFlow and IPL of dry eye in detail. Till then, stay fit, stay healthy, and take care of your eyes. Thank you.